I am Adewale. I'll be doing a presentation on human immunity. The objective of this presentation is to understand the non-specific defense against disease, to understand the concept of the third line of defense mechanism, self-recognition and tolerance, and the immune system disorder, to finally understand the biology of vaccination. What is an infection? An infectious disease are disorders that are caused by pathogens which include virus, bacteria, fungi, and parasite. Method of infection transmission. It includes direct contact, indirect contact, insect bite, and food contamination. What is non-specific defense? They prevent the entry of microorganisms into the body. They are divided into the first line defense mechanism and second line defense mechanism. The first line defense mechanisms are divided into two, which include the physical and chemical barriers. The physical barriers include the skin and the mucosa, and the chemical barrier includes the chemicals produced by the skin, such as sweat, and the chemicals produced by the mucosal membrane, such as mucus. The skin as a barrier to infection. It is the largest part of the human body which serves as a barrier to external environment. The skin has three layers, which includes the dermis, the middle layer, the epidermis, the outermost layer, and the hypodermis, which is the innermost layer. Living organisms on the skin surface cannot penetrate the skin layer because of the chemical barriers on it. Mucosa as a barrier to infection. It is another name for the mucous membrane. It protects the body from the outside environment. It comprises of three layers: the epithelium, the lamina propria, and the musculary mucosae. It serves as a barrier against foreign particles by capturing them in its sticky mucus and clearing them out. Body cavities with mucous membrane includes the nursery, the mouth, the throat, the ear, the genitals, and the anus. And the oral organs with mucosa includes our esophagus, lungs, stomach, intestine, bladder, and the uterus. The second line defense mechanism. The body reacts in various ways to eliminate pathogens in the second line of defense when the first line of defense has failed. These ways include inflammation, fever, cytokines, phagocytosis, and the complement. Inflammatory response to infection. It is a non-specific reaction strong enough to stop the spread of pathogen. As you can see from the image above, the wound is an outlet for the pathogen to enter inside the body, to the action of the blood platelet, to the action of the mast cell, to the action of the neutrophil, and the action of the macrophage engulfing the bacteria, and to the action of the cytokines repairing the body tissue. Fever as a response to infection. Fever is when the body's average temperature is raised over the homeostatic condition. It is a beneficial process if it is between 44 to 46 degrees, but anything above this could be a fatal damage to the brain. Homeostasis is at 37 degrees and fever-like temperature is at 40 degrees. Increased temperature reduces bacterial growth, stimulates phagocytosis, and speed up repair of tissues. Phagocytosis response to infection. Phagocytosis means cellular ingestion. This is a process by which phagocytosis cell, macrophages, and neutrophil engulfs and digest microorganisms. There are two types of macrophages, the M1 and the M2. The M1 dictates, ingest, and engulf bacteria, while M2 secretes growth factors and debrides damaged tissues. The role of complement as a response to infection. The complement system includes a group of about 20 protective proteins produced in the liver. They are designated proteins which are usually inactive but can be activated when needed. They become active in a sequence called the cascade mechanism. The roles of cytokines. Cytokines are soluble proteins regulating the inflammatory system. They are important signaling molecules. Cytokines can signal cell activation, cell differentiation, and cell proliferation. Examples of cytokines include interleukins, monokines, lymphokines, and interferons. How it works. When an harmful pathogen enters the body, the immune system detects it and releases cytokines. The cytokines enter a receptor and tell the cells what to do. It signals via three modalities, which includes the autocrine signaling, the endocrine signaling, and the paracrine signaling. The third line of defense. The third line of defense is a specific immune response to pathogen invasion, producing antibodies and memory cells that can be recognized and neutralized pathogens when it enters the body again. This occurs when the first and the second line of defense has failed. Antigens and antibodies. Antigens are proteins found on the surface of a pathogen. They are unique to that pathogen but also enable immune response. They include protein, carbohydrate, nucleic acid, and fat. Antibodies are proteins that protect the body from invading microbes. They are produced by the immune system and it binds to a microbe to be eliminated from the body. Antibody has two parts: the variable part, which specializes to attach itself to a specific antigen, and the constant part, which determines the antibody class. It has 5 structures, which include hemoglobin M, G, A, E, and D. Hemoglobin M, produced when a particular pathogen is encountered for the first time. It attached to an antigen by activating the complement system. It is present in the bloodstream and not in the tissue. Hemoglobin G is present in the bloodstream and tissue. It protects against bacteria, viruses, fungi, and toxic substances. It protects the fetus and infant until they can produce their own hemoglobins. It is called the secondary immune response. Hemoglobin A is present in the bloodstream, the mucous membrane, and the colostrum. It helps to protect the body from microorganisms that can invade the body from the eyes, nose, lungs, and the digestive tract. Hemoglobin E triggers allergic reaction. It binds with basophils and micelles, releasing histamine, which can cause inflammation and damage surrounding tissues. It helps defend against parasitic infection. Hemoglobin D is present on the surface of immature B cells. They help the B cells mature and are present in the bloodstream. Sensitivity to antigen. Sensitivity to antigen is an exaggerated response of the immune system to protect the body from foreign bodies known as antigens. It occurs when the immune system detects an antigen and an hyperimmune response and hypersensitivity reaction occur. It is an harmful situation that ranges from mild symptoms to more severe symptoms such as the anaphylactic shock. Causative agents can be from pollen grains to drugs, including antibiotics. There are 4 classifications of hypersensitivity. Type 1 hypersensitivity, which is hemoglobin E mediated. It causes localized and systemic anaphylaxis, seasonal allergens including hay fever, food allergens. And then type 2 hypersensitivity is hemoglobin G mediated cytotoxic hypersensitivity. Red blood cell destroyed by complement and antibody during a transfusion. And then we have the type 3 hypersensitivity, which is immune complex mediated hypersensitivity. Antigen antibody complexes are deposited in the tissue. Most common forms of these include arthritis and then lupus. Then the type 4 cell-mediated hypersensitivity. Most common form of contact includes dermatitis, tuberculous reaction, and autoimmune disease such as diabetes mellitus. The types and role of different immune cells. Leukocytes, also called the white blood cells, are the critical element of the immune system that defend the body from different infections. There are 5 types of leukocytes. They include the neutrophils, the most common type with the white blood cell in the body. They capture and destroy bacteria by invading bacteria or microorganisms by setting traps and ingesting them. Neutrophil starts the tissue repair process. We have monocytes. Monocytes become macrophages or dendritic cells when an invading pathogens enter the body. Monocytes have 2 types of cells: dendritic cells, which signal other cells to fight infections, and macrophages, which ingest and kill invading pathogen. We have the lymphocytes. They are small round cells with large nuclei. They play a significant role in the production of antibodies. They are cells responsible for the third line of defense. We have eosinophils. Eosinophils are secreted in response to an allergic reactions and parasitic and fungal infections. Eosinophils play a role in the immune system by helping it fight against infection and increasing inflammation. Eosinophil activation also causes the production of specific chemical mediators such as cytokines. Basophil. The immune system uses basophil as part of natural response. Basophil play an integral role in the preventing circulating of unwanted blood clotting. Allergic response to allergies also involve basophils. Acquired immunity. Acquired immunity, which can be adaptive or specific immunity, is not present at birth, but it is the way the body learns. It begins when an immune system encounters a foreign invader and recognizes a non-self substances. The immune system learns the best way to attack and develop a memory of that antigen so that when it comes in contact with it again, it knows the best way to attack it. The most significant component is the lymphocyte. Acquired immunity can come in three forms: in form of vaccines, exposure to infection, and via another person's antibodies. Types of lymphocytes. We have B lymphocyte, the B plasma cells, the memory B cell, the T lymphocyte, cytotoxic T cells, helper T cells, suppressor T cells, memory T cells, and the natural killer cells. B cells. The B cells response to antigens has two stages: primary immune response and the secondary immune response. The primary immune response, a slow immune response characterized by primary immune response. B cells first encounter an antigen. The antigen attached to a receptor which stimulate the B cells. Helper T cells help B cells in this process, as plasma cells produces antibodies specific to the antigen. After the treatment is neutralized, the B cells changes into memory cells. Secondary immune response, it occurs when the body experiences an attack from the same antigen for the second time. The memory B cells rapidly recognize them, multiply, and change into plasma cells and produce antibodies quicker, faster, and more effective. Types of acquired immunity. There are two types of acquired immunity, which are active immunity developed in response to an infection or vaccination. It can also be natural, which is antibody developed in response to an infection, and artificial, which is antibodies developed in response to a vaccination. And acquired immunity can also be passive, which is developed after receiving antibodies from someone or someone else. It could also be natural and artificial. Natural comes from mother to a child through the breast milk, and artificial comes from medicine. Self-recognition and tolerance of own tissue is a crucial task of the immune system. It prevents immune response against its own antigen. The lymphocyte ability to ignore self cells can be explained through the central and the peripheral tolerance. Central tolerance is the process through which lymphocytes with receptors responsive to self cells are eliminated during the early stage of its development, and peripheral tolerance guarantees that lymphocytes do not attack self cell once they leave the thymus to the periphery. Self-recognition and tolerance. B cells produces antibodies that strongly recognize host cells. Fetal-maternal tolerance prevents maternal immune response against the developing fetus, and major histocompatibility complex protein helps the immune system distinguish between host cell and foreign cells. Rejection of transplanted organs. A transplant is a medical procedure in which an organ is removed from one body and implanted in another body to replace an organ that is not functioning well. Types of transplants include autograft, allograft, isograft, and xenograft. Organ rejection. It is a process in which the recipient body rejects the new organ because it sees it as a foreign invader, similar to an unwanted infection. To prevent rejection, it is essential to find an eligible donor match using immunosuppressive drug and also the use of future transplant therapies. Stages of organ rejection includes hyperacute rejection, acute rejection, and chronic rejection. Hyperacute, it occurs within minutes of hours after a transplant. It is caused by the presence of pre-existing antibodies. The antibodies react with cells in the blood vessels of the graft, causing blood clot to form, which will prevent blood supply from reaching the graft, resulting into an immediate rejection of the transplant. Acute rejection, it occurs within the 6 months. Some degrees of acute rejection occurs in all transplants except for the transplant from identical twins. It is caused by the formation of antibodies following the detection of a non-self antigen in the donated graft. If detected early, it could be treated by suppressing the immune response to prevent permanent damage. Chronic rejection, there is no cure to chronic rejection other than complete removal. Chronic rejection commonly manifests as scarring of tissue or organs, and it occurs years or months after an acute rejection has subsided. Immune system disorder, it occurs when the immune system malfunction and start to attack the body instead of protecting it. Autoimmune disease includes rheumatoid arthritis and systemic lupus erythematosus. Arthritis. Rheumatoid arthritis is a chronic autoimmune disease in the joint on both sides of the body. Its symptoms include pain, inflammation in the fingers, hand, wrist, knee, ankles, feet, and toes. Uncontrolled inflammation damages the cartilage, acting as a shock absorber for the joint. It deforms the joint and the bone eventually erode. The risk factor includes obesity, smoking, gender, and family history. Systemic lupus erythematosus. Lupus is caused by inflammation throughout the body. It is an autoimmune disease which damages the body instead of protecting it. It can damage the tissue, the skin, blood, joints, kidney, brain, and heart. Its symptoms include headache, rash, fever, and hair loss, mouth sore, fatigue, and swollen glands. Our factors include genetic factors, hormone, environmental factor, and health history are likely the causes of lupus. Immunological memory. Immunological memory is the basis for vaccination. The immune system is exposed to weak pathogens which stimulate the production of memory cells that can respond to the pathogen if it's involved the body again. A memory cell is called an antigen-specific B or T lymphocyte that does not differentiate into an effector cell during the primary immune response but can immediately become an effector cell upon re-exposure to the same pathogen. Vaccination, it helps prevent the development of disease and reduces its severity. After the exposure, the immune system produces unique complementary antibodies that target and attach to the antigen, and the white blood cells engulf and digest the pathogen. Forms of vaccination, it includes inactive vaccines, live attenuated vaccination, messenger RNA, subunit, unit recombinant and polysaccharide, toxic vaccines, and viral vector vaccines. Vaccination program. A vaccination program is a planned and organized attempt to vaccinate a population against infectious disease. It aims to reduce the spread of disease and protect individuals. In the UK, the NHS provides a comprehensive vaccination program for people of all ages. They include from babies to adults. Herd immunity. Vaccinating the majority of the population against severe infection can reduce the chance of people coming in contact with some specific pathogens, and this leads to the concept of herd immunity. There are 3 recognized scenarios of herd immunity. Scenario 1, most of the population is not vaccinated. A few people are not vaccinated and are ill and contagious. This can result into mass infection. Scenario 2, most of the population are vaccinated against specific disease but are well. Some are vaccinated and healthy. A few are not vaccinated and are ill and contagious. Mass infection can occur. Scenario 3, the majority of the population is vaccinated. A few are not vaccinated and well. A few are not vaccinated against it and are ill and are contagious. The majority are protected due to high vaccination, but very few individual becomes ill. Factors affecting vaccine intake include risk perception and decision making, consent, severe provision, provider influence, information for parents, providers, and trust. Evaluating the benefit of vaccination, we have the advantages and disadvantages. Advantage includes effective in preventing life-threatening disease. It is safer for the body to learn how to fight diseases via vaccination than exposure to pathogen. It reduces risk of getting disease by working with your body natural defense to build protection. Vaccination can protect the lives of vulnerable adults. Then the disadvantage includes the fact that they are not always 100% effective. They may fail, and vaccine can have terrible effect from mild effect to severe effect. Summary, we've been able to demonstrate our understanding on human immunity. And for further readings, we have our references. Thank you.